Daniela, well, thank you for your invitation. And due to limited time, I will make my intervention short, but I have to mention a couple of things. Distinguished panelists, excellencies, colleagues, ladies and gentlemen, I would really like to thank the Club de Madrid for organizing this timely side event on the theme of an inclusive global strategy to leave no one behind during and after the COVID-19 pandemic, which the Division for Inclusive Social Development of the United Nations data I have the honor to lead is collaborating with. Upon the adoption of the 2030 Agenda, Member States pledged to leave no one behind, with the key goal to reach all countries, developed, emerging, or developing ones, and people. It is an agenda for the planet and for all people of all ages and abilities. Themes like the eradication of poverty, inclusion, and participation, reducing the gap of inequalities, even sport as an enabler of development and peace, as well as vulnerable groups of the society, all of this is at the heart of the work of the division that I lead. In the past years, we have been working tirelessly to ensure that the specific needs of disadvantaged and vulnerable populations such as youth, older persons, persons with disabilities, indigenous peoples, and not only heard, but also reflected in policy-making processes. And allow me also to mention, since we have the honor to have the presence of the President Danilo Turk, that this year marks the 25th anniversary of the World Summit for Social Development. And he was among the fathers of this very important World Summit that is the foundation of the work of the division. The visions, principles, and objectives of the summit remain valid and even more important today as we face unprecedented challenges posed by COVID-19. Only by placing people at the center of development, we can achieve an integrated, a whole of government, a whole of society approaches to advance social progress and enhance the well-being for all. The COVID-19 pandemic, which has started as a global health crisis, has turned into social, economic, financial, and potentially political crisis worldwide. The pandemic has exposed and exacerbated existing inequalities and vulnerabilities, deepening poverty and exclusion, and increasing social tensions as we witnessed. The most vulnerable populations are hardest hit, being pushed even more further behind, left behind. At the same time, the current crisis is a wake-up call. Where there is a challenge, there is an opportunity to build back better towards more inclusive, resilient, and sustainable pathways towards achieving sustainable development. COVID-19 shed light on the role of social inclusion of the disadvantaged groups in the implementation of the SDGs, the Sustainable Development Goals. How to overcome the past and present challenges to formulate and implement policies that are inclusive and protect the most vulnerable populations during the current and future crises and strengthen resilience is a topic that we should discuss and analyze today, not just giving diagnosis, but solutions, innovative solutions in the new world we're facing nowadays. And this is critical because we have learned we are not safe unless all are safe. Multilateralism is so important. And likewise, we cannot achieve the objectives of the 2030 Agenda unless all goals are achieved for everyone together. So with such prominent speakers, some of whom, as I said, have already the vision of a social just world back in 1995 during the World Summit for Social Development, putting people at the center of development, like the United Nations Charter. Now, the outcomes of the summit inspired many goals of the 2030 Agenda, and I am convinced that today this side event will help us to respond and recover better, implementing the SDGs with the full inclusion of all people. Thank you.
Alliance Club de Madrid, and I would like to tell you how pleased we are to participate in this important meeting on inclusive global strategy to leave no one behind during and after the COVID. So by way of introduction, I would only like to mention two things. First, Club de Madrid is an organization of about 110 former democratically elected prime ministers and presidents. And we are a group of people, many of whom are central in dealing with crisis situations in the past, both with the financial crisis in 2008, 2009, and various health-related crises such as SARS, H1N1, MERS, Ebola, and our experience is to some extent relevant, and we stand by our successors in these difficult times in the search for solutions. Secondly, we have, since the beginning of Club de Madrid, emphasized the importance of leaving no one behind and promoting what we call the concept of shared societies, societies which pay attention to all groups and which try to make sure that development is shared by all. Now, obviously, we are among those who see poverty and exclusion as basic problems of the world today and wish to find solutions to the economic problems that exist and to other problems that are there. We are funded by Alan Bart Slimka Foundation and have been involved in a variety of programs. Today, of course, we are joining an important project of the United Nations. We highly appreciate the high-level political forum, which is meeting every year, and this year we are meeting virtually. So we would like to be sure that our contribution is made. And obviously, this is one of those situations where everybody in the world, everybody who can do something helps. This is the message which I bring from the Club de Madrid, and I will be happy to participate in the panel as we proceed with our work.
Hello, everybody, connecting from around the world. My name is Andrea Ordóñez. I'm director of Southern Voice. We're a network of Southern think tanks and scholars from Latin America, Africa, and Asia. I am myself connecting today from Quito, Ecuador, and very excited to be joining this excellent panel to discuss how do we keep the premise and the promise of leave no one behind in the context of COVID-19 and beyond. So let me first, I would like to introduce our excellent panel that is joining us today. You've already met in the welcoming remarks President Turk. He is president of Club de Madrid and also former president of Slovenia. We have a former prime minister from Senegal, Aminata Touré. We will also have Prime Minister Van de Beek, who was Prime Minister of Norway twice, in 1997 to 2000 and 2001 to 2005. We have Dr. Menabte, who is the Executive Director of the WHO office in New York. And we have Professor Reddy, who is Professor of Economics at the New School for Social Research in New York, and an active discussant of the SDG processes globally. So that is our panel for today. We are very excited to have many participants joining us from around the world. To keep this interactive, we will proceed with a round of questions that we will try to keep as interactive as possible. And we will also be having some surveys in the process so that you can also engage in the discussion. Our colleague Maria from the Club de Madrid will be receiving questions and comments also in the chat. So feel free to jump in and engage in the conversation. We will make sure that we are sharing those with the panelists and that we are getting as much of an interactive discussion as possible. So with that, I would like to start again with President Turk. I would like for you to reflect on the current situation of the pandemic and from your experience, from what you're seeing around the world, what is making this crisis so different from others, and how is it that we are going to keep the promise of keeping public health for all within this context?
Well, thank you. And now let me put these things in a fairly simple way. It is obvious that this pandemic is a result of an emergence of a virus which is highly contagious, and it has engulfed the world with a speed and scope that nobody expected. So it comes as a huge surprise, and the effects are devastating. Now, the effects on the purely medical side are becoming more and more known, and I hope that the search for vaccines and for medicine will succeed. But at the same time, we understand that for the first time in this century, global poverty is on the rise. Global poverty is on the rise, and it is affecting about 70% of global population. So this is obviously an effect with huge economic and social proportions, something that we have not witnessed with pandemics or epidemics in the recent past. Now, countries affected, as I said, represent about 70% of the world's population. At a more fundamental level, it is estimated that 265 million of people are likely to suffer from crisis level of hunger. That is an increase of 130 million of people from pre-pandemic levels. Huge numbers. This is something devastating. And obviously, there are also effects on employment. According to ILO estimates, there will be about 10.5% decline of the number of hours worked, which is the equivalent of the loss of more than 300 million of full-time jobs globally. Now, this, of course, are the dimensions of the problem. A large part of that problem rests on the shoulders of the national health systems. And here we have another problem. The health systems can barely cope with that. Obviously, the situation is different from one country to another. But even in fairly advanced countries, the burden of health system is enormous. And let us put this fact in the context of the international norms on human rights, which we must not forget, which we must not neglect in these circumstances. As we all know, there is an international treaty, the International Covenant on Economic, Social, and Cultural Rights, which stipulates in its Article 12 that everyone has the right to the highest attainable standard of physical and mental health. Now, ladies and gentlemen, what is the highest attainable standard of health in this kind of circumstances? We are not talking the right to health per se. We are talking about the right to the highest attainable standard, which is something that governments must help to provide. So we have an enormous pressure on health system, which is also a pressure on human rights. And that pressure on human rights is non-political. Therefore, there should be a possibility to find a common platform to fight this problem. Now, I would like to stop here for a while and say, look, this is a problem of unique proportions, of unprecedented proportions in every respect, in purely health-related aspect, but also in economic and social aspects, reaching all the way to the enormously high amounts or high levels of the rise of hunger in the world. So there is a need for really strong and serious cooperation among states and international organizations to find ways about it. Club de Madrid has been very active in this regard. We have been in touch with the G20 several times in the past months. We are in touch with the European Union, with the IMF and other bodies in the search for finding support for the development of vaccines immediately, but also in addressing wider problems later on. And let me conclude by saying, we are now at the beginning of an era in which very serious solutions will have to be found. And those solutions may include, or probably will have to include, changes in the international understanding of such fundamental functions of states as national tax systems. The costs will be enormous, the pressure on public finance will be enormous, and the need to reorganize taxation globally to reduce or perhaps eliminate tax havens and come to the point of proper level of tax fairness will be an important task. Now let me conclude here and let me listen to my fellow panelists.
President Turk, for giving us this overview of kind of like how we should think about the response. I would like to turn now to Prime Minister Touré to take us a little bit more into the national level. You are also the Special Envoy for Internal and External Affairs of Senegal currently. And I think you are in a great position to give us a sense of how a government like Senegal is responding to the current crisis and keeping in mind the promise of leave no one behind. So if you could give us some insights from where you are at.
President Turk, to whom I send my regard, along with all the members of the Club de Madrid and all my co-panelists here. Actually, I had the chance to be appointed the president of the Economic, Social, and Environmental Council, which is an institution of the country. And I can say that from the Senegal perspective, and I can extend it to West Africa and even to Africa, the issue of not leaving nobody behind means also leaving no region behind. Because what happened under COVID-19, and I put it in a discussion that we had within the Club de Madrid, is that multilateralism and the international discussion completely went off. Every single country turned to itself, trying to find its own solution to COVID-19. So leaving nobody behind means re-dialoguing again. That's why I'm happy to participate to this discussion, because we have to rebuild multilateralism. We have to rebuild cooperation within the continent, but between the continents and others, Africa and the rest of the world. But one good thing that came out of COVID-19, which is an ongoing crisis, by the way, we are not out of it, is that some countries and some part of the world discovered that they can count on themselves, which was the case here in Senegal and in many African countries. Actually, Africa is still the least touched country of the world. That we have to say that. And it's not by random. It's not by random that that is the case. It's because the governments took some measures very early, which resulted into bringing down the number of extraction. Now we have a big challenge, how to keep that going. Because here, the dilemma is whether going out and taking a risk of being infected by COVID-19 or staying at home and having nothing to put on the table. Here in Senegal, and that's the case in the rest of Africa, 80% of the economy is informal economy. It is made of micro enterprises, sellers in the market, and they have to go out every day to look for, the way of the way of living. So what it means today, leaving nobody behind, is to build the resilience because we are within the crisis. Because one of the risks, and we've been talking, these days, we are hearing it from, many, many countries, this idea of a second wave or ongoing wave, I would say, of COVID-19 is still there. The risk is still there. So it seems like we will have to live with the virus for a longer time than expected. So we need to build the resilience of those who were even vulnerable before COVID-19 and
for your intervention and giving us a sense of how the discussion and the issues are going on in Senegal. I would like to take this opportunity to start with the interaction with our participants with a first question through a poll that we have prepared. You should be able to see it in your screen now. And the first question is, do you think that the multilateral institutions have responded adequately to contain the global COVID-19 pandemic? So that is the first question that we have in for our participants today. And please engage in the survey, and this will also guide us to keep the discussion going forward. Both President Turk and Prime Minister Touré have brought up the issue of the importance of rebuilding this multilateral system and trust. So we would like to hear also from you what is your take on it. I don't know if we can see the results now, or if we maybe continue with the conversation with Prime Minister Vondevik, who is joining us from Norway. And we wanted to get your perspective from the side of conflict and crisis, and how these are playing out currently, and what do you think should be done to prevent an increase in conflict with the pandemic going on right now?
Thank you. Let me first say that COVID-19 will be a real test of solidarity and democracy, both domestically and globally. What I am most afraid of after COVID-19 is that more people will be lagging behind and feel excluded. Also, because we know that one main source of extremism and terror is a feeling of being excluded in a society. So this is a real threat to peace and stability. So it is consequently a huge challenge to combat increased differences and exclusion, and to promote inclusion and equality. And this challenge has several dimensions. It is an economic and social dimension, and it is a political dimension. And both these dimensions are relevant domestically and globally. We know that many people have been laid off or have lost their jobs through the last months. As industry and companies gradually will start up again, it must be given priority to jobs for ordinary people, so they don't feel excluded from the job market. We know that the social network is not so good in many countries for people who are not in job. And so governments must see their responsibility to find out what they can do to help people in need, so they not feel excluded. Globally, it is obvious that developing countries have a most heavy burden. It is time for G20 and other developed countries to show solidarity, both with development, with regard to development assistance, and to make new mechanisms, for instance, trust fund, as indicated by UN Secretary General Guterres, to better meet global crises like this in future. But in addition to social and economic challenge, it's also a political democratic challenge. And that is also both domestically and globally. The time during and after COVID-19 is a real test of international cooperation and order. And this pandemic has shown us how vulnerable we are and how we depend on each other. We know it started in a town in China, and after a short time, all countries are affected, more or less. So it is for me obvious that a stronger international cooperation is needed. It's not time at all to withdraw from or weaken our international institutions. This time can also be a threat to democracy. That is a main working field of Club de Madrid, where I'm a member. Some people may ask now for a strong leader to handle the situation fast and with strength. But if you look around, I think real democratic states have met the challenge with appropriate means. And this is, we know, the only system that can include all citizens and avoid that many are lagging behind and feel excluded. So I do hope that democracy will not only survive COVID-19, but come strengthened through this challenge. And just as a response to the question that came up on the screen, I will say that multilateral institutions have not been able to create a coordinated global response of COVID-19 so far, in accordance with the UN Development Goal number 17. We know that the G20 issued a statement devoid of specifics, while the UN Secretary General has issued a report and calling for a coordination, a designated trust fund, as I mentioned, and debt relief by international finance institutions need to be tied to specific social policy impacts on vulnerable populations. The World Health Organization has worked within the capacity they have to coordinate the global response, but only one multilateral technical agency alone cannot provide the scope. So I will say experience from COVID-19 so far is that we don't have a coordinated, appropriate response to the challenge. So I hope that the UN Secretary General will initiate an evaluation on how this has been evolved and how we can develop future mechanisms to meet such challenges in a better way. Thank you.
Prime Minister van de Wijk, for your intervention. And in fact, 82% of the participants in the session join you in thinking that the institutions, the multilateral institutions, have not been ready and have not adequately responded to the crisis. And you've made an important point of noting how this includes a variety of actors at the global level. Of course, the WHO has played an important role in this, but it is not only them who are in charge of a response to a crisis as this one. But I would like to turn to Dr. Menabde to hear from you. What do you think also the WHO needs in terms of strengthening their position, and how you see also the role of the WHO in supporting the capacity of countries in responding to the crisis in the area of health and the technical expertise that you have?
Thank you. And thank you for this question. Needless to say, COVID-19 has shocked the world at a scale unmatched in decades. The pandemic has exposed so many pre-existing fault lines and exacerbated existing inequalities within our societies, and that is far beyond health sector. The pandemic has demonstrated also inadequacies of our health systems, their ability to protect most vulnerable, irrespective of nations' wealth. While the virus does not discriminate, its impacts do discriminate and often hit those who can least afford it the hardest. These are old, poor, those with chronic diseases, disabilities, poor living conditions, as well as people on the move or in humanitarian situations. So we in health community have feared this very scenario, knowing all too well how interlinked health is with safety, security, and economic prosperity. However, those interlinkages can also be used to our advantage as we reorient and rebuild with this sustainable development agenda in mind. Definitely, health sector alone cannot cope with this pandemic. And for us to achieve sustainable development goals, we need to act on all the goals at the same. We need to act on all goals at the same time. And the global humanitarian response plans, as well as socio-economic framework, constitute United Nations multilateral response to COVID-19. The world at this time really needs to break the panic, then neglect cycle and shift from reactive to a proactive mode. The high impact of COVID-19 in terms of lives lost, damage to livelihoods, and socioeconomic consequences reminds us that preparedness is cost-effective and should be viewed as an investment. Health systems, even mature ones, are at risk of being overwhelmed due to ineffective levels of preparedness, so we need to look at this very carefully. All this work should be developed with an eye on ensuring that primary health care and community-based services are strong enough to cope with such challenges. We have tools to do this. International health regulations assessed, and these assessments helped us to identify critical gaps in national and global preparedness levels to strengthen emergency preparedness capacity. WHO has worked tirelessly with partners to ensure that relevant technical guidance and strategies are implemented through multi-sectoral action by health and other sectors. Strengthening governance of multi-sectoral and health emergency management system is critical to build the resilient communities and countries. Health emergency disaster and risk management encompasses a wide range of multiple functions and components in health, but also in other sectors. For example, information and knowledge management capacities will need to be strengthened to support risk and need assessment, disease surveillance, and other early warning systems, public communications. It is important that information collection, analysis, and dissemination be harmonized across relevant sectors. Processes to monitor progress towards meeting health emergency, disaster, and risk management objectives and core capacities should be integrated into existing health sector monitoring systems. Standardized indicators to monitor risk, capacities, and program implementations are very necessary at this stage. So how do we ensure that systems work for all? Social inclusion is in the heart of the universal health coverage agenda. When we talk about policies and investments to expand coverage and offer financial protection, we're concerned with those most vulnerable, most marginalized, and thus most susceptible to epidemiological, environmental, and economic shocks. We are foremost concerned with half of the world's population that does not have access to essential health services, and the half 100 million people who fall into extreme poverty every year due to health care expenditures. The World Bank predicts that there will be increased number of maternal and child deaths as a consequence of the COVID, and that more people fall into poverty. The COVID-19 shock has underlined the importance of primary health care as cornerstone of universal health coverage. This is particularly important in disadvantaged areas, such as informal urban settings and pockets of extreme rural poverty, which may have greater exposure to risk factors, greater vulnerability due to comorbidities and other factors, lesser access to quality services, and less financial protection. Social participation encourages buy-in from vulnerable and marginalized segments of population who are often left behind. Broad social participation in shaping policies to advance health equity is justified on ethical and human rights grounds as well, but also more pragmatically. From a strategic point of view, having public ownership of the social determinants of health is vital for long-term sustainability. Emergencies can overwhelm health systems and decimate the economies that fund them. Reducing this impact is one of our most pressing priorities at WHO. It is central to achieving the triple billion goals of the World Health Organization for universal health coverage, for health security, and for health for all. This isn't the first and won't be the last global challenge we face. We must think globally, act locally, understanding that when it comes to global health security, we are all in this together. It's, in a way, test of character, as our Director General says. The COVID-19 pandemic has given us a view into what our world could resemble if we took the bold steps necessary to curb climate change and air pollution. We must build back better and build back greener. Thank you for your attention.
For your intervention and for giving us a sense of what is in the plans for WHO as well. And before I go to Professor Reddy, I think we can go ahead with the second question of the poll before his intervention, which relates to the to your concerns of how the pandemic is affecting the implementation of the Agenda 2030. And this is a very much related question to what we had in mind for Professor Reddy, to give us a sense of how do you think that the UN system, the SDG processes should innovate in light of the pandemic? And after your intervention, we'll also hear about the results of the survey and see where we are on this one.
Thank you very much, Madam Moderator. My comments are going to very much echo those of the previous participants, and most especially of Prime Minister Bondevik. And I'm glad to know that I'm in accord with 82% of the participants, or rather 82% of the participants are in accord with me on this issue. I think that the global institutional architecture has unfortunately shown itself to be wanting in relation to the response to COVID-19. Just today, there was an announcement, you might have seen it, that Oxfam has done an estimate that the same or a larger number of people may die of undernutrition as a consequence of the response to COVID-19 than may die of COVID-19 itself. Now, whether or not that is true, I regret, we'll have to wait to see, and I certainly hope it's not true. But that is an example of the enormous social and economic consequences of the response, which I am sorry to say were not adequately anticipated, it seems, either at the national or the global level, in determining what measures to take, how those measures should be designed, and what accompanying or complementary measures were required in order to ensure that the economic and social costs were as low as possible. I have studied the work of the epidemiologists who have been very influential on this issue, and although it is forgivable because they are, of course, researchers who have a very narrow concern, by and large, they did not consider the spillovers. But it is more damning that national governments and indeed international agencies were quite slow to understand that there would be spillovers and to examine this issue. Now, it was not completely unanticipable that such a situation could arise. I think you would all agree. Whether or not it would take this specific form and when it would take place was, of course, unknown. But that such a situation could arise, a global pandemic, which would require a response of this general nature and on this scale, was anticipable. Indeed, it was anticipated. Did we have the institutional architecture in place to address such a contingency? I think the answer would have to be, regrettably, no. Now, if one goes back and look at the various documents which have been produced over the decades on global governance, one will see proposal after proposal as to how the relevant interlinkages and complementarities could be better taken into account. The Commission on Global Governance, for example, in the mid-1990s, or the Stiglitz Commission in 2009, which focused on economic questions narrowly, more narrowly, I should say, because they're not narrow at all, and proposed a Global Economic Coordination Council. Or for that matter, the independent team of advisors to the ECOSOC dialogue on the reform of the UN development system, of which I was a member, which proposed a sustainable development board, which would enable such coordination to take place to a greater extent. None of these measures have been adequately considered, let alone implemented. I suggest that the experience to date underlines the need for what we might call, broadening the recommendation of the Stiglitz Commission, a Global Economic and Social Coordination Council. As President Bondevik noted, one technical agency of the United Nations could not suffice, or Prime Minister Bondevik, excuse me, could not suffice to take note of the relevant concerns because its mandate was not sufficiently broad to allow it to do so. It was simply not permitted to take note of the complementarities and interlinkages that are involved, let alone encouraged to do so. And indeed, the United Nations, even at the highest level, was slow to respond to some of the obvious concerns. Take, for instance, and I will end with this example because I know I will have more opportunity to discuss these issues and the SDGs specifically as we go on. The case of the vaccine that is being developed, we hope, in response to COVID-19, the subject, as you know, of a campaign for a people's vaccine, which will be available as freely and as universally as possible the world over. Now, even today, there are debates taking place, and there is something of an impasse about very basic questions, such as to what extent the intellectual property which is being employed to produce a vaccine, or which will be quote-unquote intellectual property, or which will be embodied by the vaccine, will be treated as private property or as public property. And of course, there are very different views on this on the part of different countries. But this is an example of something in which the Secretary General of the United Nations, an issue on which the Secretary General of the United Nations and others could have, should have, it seems to me, taken a very early and clear normative stand. The SDGs, it seems to me, cannot, should not ever have been, and should not now be approached in a Panglossian fashion. We must understand that there are potential setbacks at each and every stage, and we are indeed experiencing one at this very moment. And that requires a flexible response, the possibility of a flexible response to be built in to how we deal with the SDGs at every level, from voluntary national reviews through to global decision-making. But I hope we will have a chance to return to these issues later. Thank you.
Thank you, Professor Reddy. And I will share briefly some of the results from the survey. Even more so than in our previous questions, there is an almost total agreement with a concern of how the pandemic is affecting the 2030 agenda. And then you can see that 94 are really concerned with how this affects the SDGs and the 2030 agenda. So I think it's very important to be thinking of these innovations and these ways of coordination moving forward. And I would like to take the opportunity to start feeding in some of the questions we are receiving from the floor in the platform. And thinking about this, that many of you have commented on about the need for a new ways of building trust, new ways of finding consensus. We also know the difficulty of that in the current political setting. So I would like to go back to President Turk to see if you have something to say about this question of where do you see that social consensus could be built? In what area should we be focusing our efforts of building a new social contracts and new agreements and consensus? So we're going to go back to President Turk in a little bit because his connection is not very good. But I would like to turn to Prime Minister Touré. There is a question here in the panel, in the discussion, also coming from Latin America, but I think that it relates very well to Africa as well, about what is the opportunity for regional coordination and collaboration, and how do you see these emerging in, and how can it be more successful?
Well, I mean, I do see it, first of all, in medical knowledge sharing. You talk about developing vaccines. Let me also inform you that there are several trials going on in Africa, in South Africa, in Madagascar. Here in Senegal, there were rapid testing research that needs to be brought together on a regional or continent-based collaboration. So that's the first thing I would see, is how are we going to make sure that we put our knowledge together so we do have a solution in terms of discovering whether it's rapid testing, vaccine, and and it speaks to the medical sovereignty I talked about. How are we going to be self-sufficient to address the pandemic that can run in a longer term than expected? So cooperation is key. Secondly, when it comes even to economic recovery, I do think that we have no other way than putting also our forces together, and that's where the regional grouping are going to play a very important role. ECOWAS, which is the gathering of the West Africa states, they are discussing about sort of a sub-regional resilient economic plan. So the economies have to be more integrated. And of course, you do have the discussion even of common currency going on in West Africa. So I do think that COVID-19 can be an accelerator of integration, because each of the states would build upon its comparative advantage, collaborating with others, so they can have sort of an integrated response to it. So I see that happening in the medical field, in the pharmaceutical production. In Africa, one of the key issues is how are we going to develop Africa-based big pharma so we can produce the medicine we need at an affordable cost. Really good one. So that's why I was saying that the key word for me is resilience. How are we going to build internal resilience sub-regional resilience, because that's what happened over the 4 months. When there was no international cooperation, there were no blame, there were nothing. People were left with their own expertise. So a sort of a self-confidence is building up, and that needs to be supported either by the UN, by other, on an international or multilateral basis. But I think if we want to rethink international cooperation, that's what it's supposed to be. It's supporting internal and sub-regional initiatives so they can be base of the cooperation that is foreseen.
Thank you, Prime Minister Touré. And we also have in the floor an interest in understanding also how this cooperation is happening in the Nordic countries. That is a strong bloc that has responded proactively in many cases to the crisis. So I would like to turn to Prime Minister Van de Beek to see if you could answer this question about how the Nordic countries have been collaborating. How do you see the strength of the group?
To coordinate their but we have also seen that they have taken very different decisions. Sweden have had another approach than the other Nordic countries. And unfortunately, we also see that Sweden have a rather high rate of death because of COVID. And there is a discussion going on. And now when we open the borders again, Sweden is excluded from the opening of the borders with the countries. So I think this will be a part of a strong discussion after COVID-19 as well. We have a Nordic organization called the Nordic Council, but to be honest, that is not a strong organization. It's more an advisory body to the national governments, and they can not act on behalf of the Nordic governments and countries. We know also that 3 or 5 Nordic countries are members of the European Union. 2 of us are not. So in that way, we are not on the same track. But I do agree with my colleague from Senegal that I think that the regional organization must sit down and discuss now how they can strengthen their cooperation and coordination through crises like this. Of course, we have the European Union, which is covering most of Europe, but not all countries. And I don't know, Madame Touré, if the African Union can play a role to discuss how you can coordinate your efforts for future crises.
Thank you, Prime Minister Van de Beek. I think that thank you for bringing back again the need for the evaluation and to think of this global coordination. And maybe now I can go back to President Turk, who we were listening to, but we couldn't complete his intervention regarding in what areas you see this possibility of further consensus building and coordination. President Turk?
Yes, well, I didn't hear your comment or question.
So I was asking if you could maybe repeat again what you had mentioned, what you started to talk about, of what would be the links, the opportunities for social cohesion and coordination moving forward. I think we're struggling still with the sound with President Turk, unfortunately. We'll take a small break to go to our final poll of the day before we move to some additional questions from the discussion. So here is the final poll. Which says, do you think the experience of the global COVID-19 pandemic has led to better preparedness for future global crises? And I think this connects very well with the questions that were also in the panel. For example, Professor Reddy, to comment more on this, on how do you think that the COVID-19 crisis will change this preparedness, or this need to be prepared? Are you hopeful, or where do you stand on this?
Well, Andrea, I think I already noted that there could have been greater preparedness for this particular contingency. I think that one of the things that is underlined here is that the SDGs, if they are to be achieved or achievable, have to involve much more of an ongoing, flexible mechanism, not just of monitoring progress toward the SDGs, but of determining the suitable responses at national, regional, and global levels. And this requires, among other things, a much strengthened system of so-called voluntary national reviews of progress toward the SDGs, which in my view should involve a much richer dimension of review on the part of civil society actors and of countries by one another in order to determine what steps are being taken, but which also involves a vertical component in addition to the horizontal component, bringing in much more centrally the question of how the regional actors and the global actors can support national development. And I think that one thing that we will see in the aftermath of COVID-19 is that the slogan of rebuilding better is not one which can be entirely left, if it's to be realized, to individual countries, that there will have to be a regional and indeed global response that will make it possible to rebuild better. If I may give one example, we know that small and medium-sized enterprises around the world have been extremely badly hit. Informal sector enterprises as well, as Prime Minister Touré pointed out, and these need special support. But it's not enough to leave individual governments. It will also require very substantial help from international agencies and indeed a more robust growth framework in the whole world in order to facilitate that rebuilding. So I think that we ought to not take too narrow a view of what individual actors should do or what's required. Yes, the impact has been very disproportionate of the response to COVID-19. It's in some ways been the opposite of leaving no one behind. We have hurt those who are most vulnerable the most. But in order to address that, we will also need a much more favorable framework for growth and development worldwide, which requires coordination on how that will be possible at the level of governments that can benefit all. Of course, one could go into more detail about how small and medium-sized enterprises, for example, can be given a helping hand. There are already some initiatives. The IFC, the World Bank have, for example, instituted one lending program which is specifically focused on SMEs in the aftermath of the crisis. But much more of that nature can be done.
Now turn to Dr. Menabde. There are a few questions on the floor regarding to how we can ensure that the responses that the governments are putting in place right now ensure to be reaching those that have disabilities, those that don't have access to proper education, to proper communication. So if you could elaborate a little bit in strategies maybe that you've seen that could work in this sense, or ideas that are emerging in WHO to ensure that the responses are reaching these particular groups.
Thank you. As a whole core topic of our conversation is that there are people that are being left behind for a variety of reasons, is that we are not perfect in the way we respond to the crisis now. So the big part of this work is on the development of the national response plans, preparedness and response plans, in which we, of course, not just as WHO, but as a whole entire UN community, but also beyond UN, are engaged. And that requires very broad consultation with civil society, with the government, within the government, with the international community, and so on, with private sector, to make sure that none of the critical elements of response is being missed out, especially for those that are disadvantaged or are in the humanitarian crisis or are on the move or are unemployed or are youth or are elderly and so on. So all these elements, we work on kind of guidance provision. We are engaged in helping governments to make sure they did not miss their critical issues and aspects. And all that has to come into the national consolidated plans and also into the regional plans and then global plans. I think the point here is that no country can afford to do it in a way that it does leave gaps behind, because once any country has COVID, every country is at risk. So it's an all country response system that we are dealing with here, and that requires broad based consultation. When WHO was established, it was established on the premise that health is human right for all people and not just for those people who can afford it. And to make that a reality, one example of it is that we must work together to make sure that whatever vaccines and therapeutics are going to be developed, they are available equally for all countries and for all people. And that's a challenging task. And we have various platforms where we work on this. COVID is a challenge, not just in terms of access to healthcare and saving lives of people who need help or care, but it's also an economic challenge, it's also a scientific challenge, and it's also a political challenge. So we need to work on all these dimensions in various platforms and use all the opportunities to come up with not fragmented, but integrated, all consolidating approach to respond to this crisis. Thank you.
Your insights. I would like to keep going on through some of the questions that we're receiving in the chat, and there is some interest also on understanding what is the possibility of engaging that governments engage with civil society for policy making, for the processes of the SDGs, the voluntary national reviews, in the context of the pandemic. So I would like to then again turn to our former heads of state for some insights on these. So President Turk, do you have any advice on how governments can approach keeping doors open with civil society in these times of COVID-19? It seems that we're still are having a challenge with the audio with President Turk. So I'll turn to Prime Minister Van de Beek with the same question of how can governments keep up the work with civil society, keep the doors open to working with broader stakeholders.
I think civil society is very important. It's not only about the private families and governments, it's about society in between, the civil society. In the Nordic countries, we have very strong non-governmental organizations also working on the social and humanitarian field and with health issues. And there has been a very close cooperation between them and the government during this pandemic. And I think that can be a model also for other countries. I have also two other important questions that I want to raise now, because we also see tendencies in some countries saying that, from politicians and others, saying that we must rely on ourselves. We need our own reserves for food, for medicine, and so on. A more nationalistic approach. So I'm really wondering, and I would like comments from others as well on that. Do you think that after COVID-19 we will have more multilateralism, as we have all spoken for, or do we may see a tendency for more nationalistic approach as a consequence of COVID-19? And since Club de Madrid is an organization working for democracy, called Democracy That Delivers, I think also the issue that I raised in the beginning, will this pandemic strengthen or weaken democracy all over the world? Do you think that people see that we need democratic processes handling this crisis like this, or do people now demand a more authoritarian approach to have a faster and efficient handling of a crisis like this? That is, for me, also very important and interesting question.
And I think I will turn to Prime Minister Touré to see what her take is on this question of what you see citizens in Senegal and in other countries in Western Africa demanding for. Are we demanding more democracy, or are we demanding, more autocratic measures? And
I don't think the question should be put that way. I think citizens would be more demanding of affordable health services, and they would claim more rights to have access, the right to live to begin with, and they will enforce it. So I think that's the way to look at it. It's not about losing democracy for health or leaving democracy for economic development. It's a package. On the contrary, I think that the population will be more putting the leaders, asking for more accountability. That I see that coming. Africa is a very young continent. Let me tell you that 75% of the population is below 30. So these young people, I don't see what argument you can bring to them to tell them that they will have less democracy because of COVID. On the contrary, I do expect, and that's where the previous question is important, the leaders must link with civil society organization, with youth organization, with women organization, to design, sort of a response, a collective response that address everybody's need when it comes to access to health and access to a decent way of living. On the contrary, there will be more demand for democracy, and the leaders, will have to deliver on that. On the question about, counting on ourselves, I think if we really would like to be in line with what is the mindset, especially in this part of the world, because I speak from my experience, for 4 months, the borders were closed. For 4 months, we had to count on ourselves. So people would like to prevent, to face shortages of medicine, shortages of doctors, and I think that's where, when I talk about rediscussing at the international level, how can we be useful, whether it's the international NGOs or the UN, it's to sort of support government on their claim of health sovereignty. That's very, very, very important if you want to really create sort of a new way of working together.
Thank you, Prime Minister Touré. And I think I would like to go to Professor Reddy to your impressions of this discussion of whether we will move towards more closed borders, more open borders. What do you foresee in the future?
Thank you. Well, first of all, if I may, I'd like to comment briefly on the question of multilateralism. It seems to me that if we have to choose between more multilateralism and less multilateralism, it's blindingly obvious that more multilateralism provides a better solution. Now, whether we will have the better solution will, of course, depend on a lot of political and other factors. But it is very clear from the standpoint that what are called global public goods are involved in the case of health, but also in the case of economic security, that global coordination is desirable. Now, it is also true that the rules we have had as part of what is sometimes called the neoliberal era of globalization were perhaps not optimally suited in order to achieve the inclusive, economically and socially inclusive models that we may wish. And so I think we should have a discussion about what those rules should be. If we are looking forward, for example, to a resumption of trade internationally, what is the role which considerations or concerns of inclusion in one way or another should play within the system? Some people have referred to the approach which some countries have taken in the case of the pandemic as a sicken thy neighbor approach, which echoes what was supposedly done during the Great Depression, when individual countries raised tariffs in the so-called beggar thy neighbor approach. But after the Second World War, it was widely understood that beggaring thy neighbor was not a formula for prosperity, and neither is sickening thy neighbor a formula for health. On the question of democracy and authoritarianism, I would say similarly, we have governments which make good decisions and governments which make not so good decisions, and some of them are democracies and some of them are not. But we certainly have no suggestion at all that short-circuiting the mechanisms of democracy is at all a help in relation to addressing a crisis of this kind. And indeed, there are many good reasons to think that the opposite is true. So as far as exactly what trajectory we will take coming out of this crisis, I hope very much that it will be one which seeks a resumption of trade, a resumption of international contacts as important goals from both an instrumental and an intrinsic point of view, and at the same time is open to a discussion about what exactly the new rules should be.
Thank you, Professor Reddy. And I would like to connect this discussion that we're having currently about the role of civil society, the role of democracy, with another concern that is being raised in the Q&A for Dr. Menapte. There is a concern that civil society has not been that included in the management of COVID, and that it has been maybe too much led by experts. So how do you think this should be managed, this approach of following expert advice, but also listening to civil society and others engaged in these debates?
To consciously create much broader platforms with engagement of civil society in majority of decisions. Obviously, there are technical decisions which are based on expert opinion, and there are processes for that, but there is a lot of community engagement in the COVID response, and we have seen that in Ebola response and many other occasions when without having community with us, we are not going to win this battle. So I believe it's just for all of us to create more opportunities and open up more for civil society engagement. I have heard in some of the other panels that I have participated how difficult it has been for civil society to get funding for continuation of their work, because a lot of the new funds which are mobilized are often going to bigger institutions or to the international agencies, and those grassroots NGOs, they are often left without any resources to really make the difference that they are supposed to do. And that is about kind of grassroots institutions involved in gender issues or in access issues or in many other education aspects and many of those things. So I think we need to really link this to ensure that there is a sustainable funding continued to support civil society movement and involvement in the COVID response. And that is up to the not just national governments, which is also an important player here, domestic resources, but also international overseas development assistance should be available for civil society engagement without disruption. And that, I think, is an important factor that we have singularly look at. Over.
We will go to Prime Minister Van de Wijk, who wants to intervene.
Listening to our health experts, but they have also engaged the important civil society organizations. Let me take an example. If you should open up again now for football players to meet and play on the field, they have had a dialogue with the Norwegian Football Association, and they have not agreed all the time, but they have increased the understanding between the government and the health experts on the one hand, and the sport organizations on the other, who want to open up as much and as fast as possible. And this has also to do with how to anchor the decisions, how to get the decisions accepted by people, by the population. So if you have this dialogue with civil society organization, it's much easier to get the decisions accepted by the people. Another example is of course the schools and universities. When and how shall you open the schools again for pupils and students coming and meet? And there the government had to listen to health experts, but they also had a dialogue with the organizations of teachers and of parents for our schools and universities. And this helped to anchor the decisions also among ordinary people and get the decisions accepted. So this is an important dimension of the relations between government and civil society.
And the concrete examples that you've shared from Norway. We're reaching the end of the panel, and before I go to the a final 2 minutes for each panelist to give their final thoughts, I would like to share the results from the last poll we carried out, which said, do you think that the experience of the global COVID-19 pandemic has led to better preparedness for future global crises? And in this one, we have a division in the results. 48% say that yes, we're better prepared, and 52% say no. So I think this is an interesting dividing result, and maybe in your last 2 minutes of comments and interventions, you could respond to these and how we can, move ahead with improving our preparedness. So I would like to start with Professor Reddy for this last round of comments.
Thank you, Madam Moderator. Look, I think that we need to do a lot more scenario building as a general matter to consider what kinds of possible situations could arise and what the implications would be and how we should respond to them. I think that this was not done in relation to COVID-19, but there has to be much more of a robust mechanism for anticipating potential difficulties along the way if we are going to formulate global goals such as the SDGs. And there has to also be a mechanism for flexibly revising national, regional, and global plans in that light. One of the things that I have very much in mind in thinking about COVID-19 is that it is a case in which it's not simply lives versus livelihoods, as some people have put it, but rather lives versus lives that are involved. There are different aspects also of people's lives which are involved. And so formulating sensible policies at any level requires listening to people, as we just heard from Prime Minister Bondevik, because governments have to be informed by people as to what their values are, as well as concerning what are the empirical questions which will have to be addressed in order to make the trade-offs that have to be made sensibly. And this is not just a question of periodic elections, it's a question of having a much thicker set of mechanisms of consultation which can be drawn upon, and which can also allow people to be convinced of what it is that has been decided upon. My own view is that there has been, and there is, much more scope for intelligent, or what we might call smart policies in response to the coronavirus, but also in response to many of the other challenges that face us, which allow us to diminish or to avoid some of the trade-offs which are present. But that requires not just technocrats which are who are brought together in a room making decisions, but it requires the kind of consultation with all aspects, all sections of society, which Prime Minister Bondevik referred to.
Thank you, Professor Reddy. Dr. Menat Beg, can I turn to you for your last 2 minutes conclusion for the panel? Sorry, we cannot hear you.
As we define in WHO, there are several goals that any health system has. Equity, health equity, is one of those goals. But the other one, very important one, is responsiveness. And that responsiveness has to do with assessment, how people who experience interaction with health system perceive the service they receive, how they like it, how much they want to go there, how their dignity is respected as they interact with health services. So the responsiveness is as much important element, and it requires indeed interaction with the whole society. Health systems are owned by people, and they have to reflect cultural but also societal values of any particular community. So this crisis gives us opportunity to revisit in every society, and globally and regionally and in the country, where we stand vis-a-vis what we want our society to be and how we want to respond to any such situation. So the question whether we are better prepared, I don't think we are yet better prepared. I think we have learned a lot how to be better prepared. And the question is now whether we will be able collectively to pull our differences aside and build on the things on which we agree and try to build better for the future, the bag for the future, so that when this happens again, then we are better prepared. That's a long way to go. It requires multi-sectorial, well-coordinated, societal value-based approach and all engagement approach. It has never been easy. It's not going to be easy now, despite of the clear evidence that lack of such approach causes much of a threat to our existence as a humankind. So I think we just have to take it seriously and indeed show the will and capacity to overcome those challenges which are preventing us from being more effective, more efficient, more transparent, more accountable, and more action-oriented. And we have to look at the lessons learned. And today, WHO Director General Dr. Tedros has announced the establishment of independent panel for pandemic preparedness and response. This is to evaluate global response to pandemic, which was requested by the World Health Assembly. And this panel will be chaired by Helen Clark and Sirleaf Johnson. So they will be leading work on looking at each and every aspect, not only of WHO, but globally response to COVID and COVID-19 crisis. And we will have some intermediate results by January next year, and we will have more substantive report on this independent panel in May next year at the World Health Assembly. So I think we need to be open for learning lessons and applying those lessons in action. So we need to walk the talk, actually. So that's not easy, but with good spirit and good intentions, I think we have enough of ambition to succeed on this path. Thank you.
Thank you. I would like to turn to Prime Minister Van de Beek, please, for your last reflections on the panel.
Thank you so much. I think I can be rather brief because I very much agreed on what was now just said by Nata Menabde from WHO. If on the question if we are better prepared for future crises, and I'm sure they will come, but they may be different from COVID-19. But that will, of course, depend on how we now move forward. We have to evaluate how we tackled this challenge. And this must be done both on national level in every country and on international level. And especially the lack of coordination between important international institutions and organizations. Of course, we also have to get have an evaluation of the healthcare system on both national level and global level. And I do hope that conclusions out of this also will be that we need more, not less, multilateralism, and that we need more, not less, democracy. I think that will put us in a position where we will be better prepared for future crises. So this is an important discussion, and I thank the organizers for making this possible.
I'd like to turn to Prime Minister Touré for your concluding remarks, please.
Look up to WHO to gather all the good case studies and to share them with the countries. I think you must put your national offices in work. So very quickly, we have an idea of what have worked and what didn't work. That's what we expect from WHO. I think that should be one of your first tasks. And if we know what have worked and we share it, and then we will be better prepared. For Africa, one thing that we didn't say enough, we have built upon our experience on pandemics, including HIV/AIDS, and even all the pandemics that went along, and we learned from it. So learning process are very important to get better prepared. What happened in Africa didn't happen by random. It didn't happen just because the population is young. No, it's because the government could tap on some resources that have been here, reflecting on HIV/AIDS, reflecting on Ebola, and trying to find a way. So I do expect strongly, otherwise I would be despair of United Nations if we don't get prepared for another crisis, learning from this. So, I don't beat around the bush. I hope and we must be better prepared. We must talk to NGOs to know what they have learned. How did they proceed in local communities? We must work with women organizations and young people. They have been active during all that period. So then, if you have a companion of what have worked, and we support countries to be more resilient, then we will be better prepared. So thank you very much for organizing, this discussion. I hope that the dialogue will go on, and that's how we're gonna get better prepared.
Thank you, Prime Minister Touré. I think It has been a great session and a great set of concluding remarks to have you all reflect on this and how we can get better prepared for the future, and the amount of work that is ahead of us from the different areas where we are, whether we are in civil society, in academia, in the public sector, in the private sector, that we really need to create those opportunities to learn from this crisis, and to learn from different countries independently of our region, of our income levels, and so on. So I would just like to thank now our panelists for joining us from around the world, to the World Leadership Alliance Club de Madrid, and you, Endesa, for hosting this conversation. And we do hope that the rest of the sessions in the High Level Political Forum are as successful as this one. So thank you very much, everybody, for joining.